Well, hello, I'm Professor Capron. Welcome to this presentation on sinus bradycardia. Let's look at the learning objectives for this presentation. By the end of this presentation, you will be able to identify the key characteristics of sinus bradycardia on an ECG, understand the physiological mechanisms underlying sinus bradycardia, recognize the clinical presentation and symptoms associated with sinus bradycardia, discuss the medical and nursing management strategies for patients with sinus bradycardia, and identify related conditions and risk factors associated with sinus bradycardia. These are the key terms for this presentation. Please make sure you understand them. If you're still not understanding them after this presentation is completed, please come see me in class. Let's look at the ECG characteristics of sinus bradycardia. The rhythm in sinus bradycardia is regular, meaning that the intervals between each heartbeat are consistent. This regularity is a hallmark of sinus rhythms, indicating that the heart's electrical impulses are originating from the sinoatrial SA node, the natural pacemaker of the heart. In sinus bradycardia, every P wave, which represents atrial depolarization, is followed by a QRS complex, representing ventricular depolarization. This one-to-one relationship confirms that the electrical impulse is successfully traveling from the atria to the ventricles. The presence of a normal P-wave morphology suggests that the impulse is originating from the SA node. The defining feature of bradycardia is a heart rate that is less than 60 beats per minute. While this slower rate can be normal in well-conditioned athletes or during sleep, it can also indicate an underlying issue if the patient is symptomatic. So it's important to correlate the heart rate with the patient's clinical condition. The PR interval in sinus bradycardia remains within the normal range of 0.12 to 0.2 seconds. This interval represents the time taken for the electrical impulse to travel from the atria through the AV node and into the ventricles. A consistent PR interval within this range indicates that the conduction pathway from the atria to the ventricles is intact and functioning properly. The QRS complex duration in sinus bradycardia falls within the normal range of 0.06 to 0.12 seconds. This duration reflects the time it takes for the ventricles to depolarize and contract. A normal QRS duration indicates that ventricular depolarization is occurring normally and that there are no delays or blocks in the ventricular conduction system. Let's explore the physiology behind sinus bradycardia. The sinoatrial node, often referred to as the heart's natural pacemaker, generates electrical impulses that regulate heartbeats. In sinus bradycardia, the SA node activity is slower than normal. This can be due to various factors, including high vagal tone, the effects of certain medications, or intrinsic heart diseases. The vagus nerve, part of the parasympathetic nervous system, plays a crucial role in regulating heart rate. Increased vagal tone means there is heightened activity of the vagus nerve, which releases acetylcholine that acts on the SA node to slow the heart rate. High vagal tone can be seen in well-trained athletes during sleep or as a response to relaxation techniques. However, it can also be pathologically elevated due to conditions such as vasovagal syncope or carotid sinus syndrome. Intrinsic factors refer to the natural changes and conditions within the heart that can affect the SA node's function. As people age, the SA node and the overall conduction system can undergo degenerative changes, leading to a slower heart rate. Additionally, intrinsic heart diseases, such as ischemic heart disease, myocarditis, or fibrosis of the conduction system, can impair the SA node's ability to generate impulses at a normal rate. These conditions can lead to a decreased automaticity of the SA node, contributing to bradycardia. Certain medications can also contribute to sinus bradycardia by affecting the SA node's function or increasing vagal tone. Common culprits include beta blockers, which decrease heart rate by blocking the effects of adrenaline. Calcium channel blockers, which reduce the heart's contractility and slow down electrical conduction, and digoxin, which enhances vagal tone and decreases the SA node firing rate. Let's look at the process of completing a comprehensive assessment of a patient with sinus bradycardia. So, we need to be able to recognize clinical presentations, evaluate hemodynamic status. We might need some continuous ECG monitoring, and we absolutely need to perform a thorough physical examination. Patients with sinus bradycardia often present with symptoms such as fatigue, dizziness, syncope or fainting, and hypotension or low blood pressure. These symptoms are primarily due to the reduced heart rate, which can lead to decreased cardiac output and insufficient perfusion of tissues. Fatigue occurs because the body is not receiving adequate oxygen and nutrients. Dizziness and syncope are caused by insufficient blood flow to the brain. Hypotension results from the overall decreased blood flow and pressure within the circulatory system. It is essential to closely monitor the patient's hemodynamics to assess the impact of bradycardia on their overall stability. Regularly check the patient's blood pressure and pulse to ensure that the heart rate and blood pressure are within acceptable ranges. Look for signs of hemodynamic instability, such as changes in mental status, decreased urine output, cool and clammy skin, or chest pain. Monitoring these parameters helps to determine the severity of bradycardia and to guide further interventions. Continuous or routine ECG monitoring is vital for confirming the presence of sinus bradycardia and identifying any associated arrhythmias. An ECG provides a visual representation of the heart's electrical activity, allowing us to measure the heart rate and assess the rhythm. For continuous monitoring, patients might be connected to telemetry units that provide real-time data on their cardiac status. Routine ECGs can be performed periodically to track any changes in the heart's electrical activity over time. Conducting a thorough physical examination is a key component of assessing sinus bradycardia. Begin by auscultating the heart to evaluate heart sounds, noting any abnormalities such as extra beats, murmurs, or irregular rhythms. Next, assess the peripheral pulses, including the radial, brachial, and pedal pulses to check for strength and regularity. Weak or absent pulses can indicate poor perfusion. Additionally, evaluate capillary refill time by pressing on the nail bed until it turns white, then releasing and observing how quickly the color returns. A capillary refill time of more than 2 seconds suggests compromised circulation. Also, observe the patient's skin for color, temperature, and moisture, as pale, cool, or clammy skin can indicate poor perfusion. Let's look at the medical management strategies that we can expect providers to implement for sinus bradycardia. Atropine is a first-line medication used to manage symptomatic bradycardia. It works by blocking the vagus nerve's influence on the heart, which therefore increases the heart rate. Atropine is typically administered intravenously at a dose of zero point 0.5 milligrams, which can be repeated every 3 to 5 minutes up to a maximum dose of 3 milligrams. It is important to monitor the patient closely after administration for any improvement in heart rate and symptoms. However, atropine is not always effective in patients with severe conduction system disease, such as those with a high-grade AV block. In these cases, other interventions may be necessary. If a patient remains symptomatic despite treatment with atropine, or if they have recurrent episodes of symptomatic bradycardia, pacemaker may be indicated. Pacemaker is a small device implanted under the skin, usually near the collarbone, that sends electrical impulses to the heart to maintain an adequate heart rate. There are two main types of pacemakers, temporary and permanent. Temporary pacemakers may be used in emergency situations when the bradycardia is expected to just be temporary, such as after a myocardial infarction. Permanent pacemakers are used for long-term management of chronic bradycardia. The decision to implant a pacemaker depends on the patient's overall health, the severity of their symptoms, and the underlying cause of the bradycardia. It is crucial to identify and address any underlying causes of sinus bradycardia to prevent recurrence and improve overall patient outcomes. Some common causes include certain drugs, such as beta blockers, calcium channel blockers, and digoxin, which can cause or exacerbate bradycardia. Reviewing and adjusting the patient's medication regimen may be necessary. Hypothyroidism can slow down the heart rate. Thyroid function tests should be conducted, and if hypothyroidism is confirmed, appropriate thyroid hormone replacement therapy should be initiated. Conditions that increase vagal tone, such as vasovagal syncope, can lead to bradycardia. Identifying triggers and implementing strategies to reduce vagal stimulation can help to manage these cases. An acute MI can damage the heart's electrical conduction system, leading to bradycardia. Management involves treating the MI with revascularization procedures, medications, and supportive care. Additionally, abnormal levels of potassium, calcium, or magnesium can affect heart rate. Correcting these imbalances through supplementation or dietary adjustments is essential. Now let's focus on the nursing management of patients with sinus bradycardia. Continuously monitor the patient's heart rate using ECG to detect any significant changes or trends. This helps to identify any worsening of the bradycardia or the emergence of other arrhythmias. Regularly check the patient's pulse manually as well, particularly if an ECG monitor is not available. Assess the patient for symptoms associated with bradycardia, such as fatigue, dizziness, syncope, and hypotension. It is essential to evaluate the severity and frequency of these symptoms to determine the impact on the patient's daily life and to guide treatment decisions. Regularly monitor blood pressure, respiratory rate, and oxygen saturation to assess the patient's hemodynamic status. Hypotension and hypoxia are critical indicators that require immediate attention and intervention. Review the patient's medication regimen, especially if they are on beta blockers, calcium channel blockers, or digoxin, as these medications can contribute to bradycardia. Collaborate with the healthcare provider to adjust dosages or discontinue medications as necessary. Educate the patient on modifying their activity level to prevent exacerbation of symptoms. Advise them to avoid strenuous activities that could lead to dizziness or syncope. Encourage them to take breaks and pace themselves during physical activities. Teach the patient and their family members how to recognize early signs and symptoms of bradycardia, such as unusual fatigue, lightheadedness, or fainting spells. They should be instructed to seek medical attention promptly if these symptoms occur. Encourage the patient to regularly check their pulse at home and keep a log of their heart rate and any associated symptoms. This information can be valuable during follow-up appointments and for ongoing management. Discuss the importance of maintaining a heart-healthy lifestyle, which includes a balanced diet, regular physical activity, adequate hydration, and avoiding smoking and excessive alcohol or caffeine consumption. Ensure the patient has regular follow-up appointments with their healthcare provider to monitor heart function and overall health status. These checkups are essential for adjusting treatment plans and addressing any emerging issues. During follow-up visits, the healthcare provider might order repeat ECGs, Holter monitoring, or other diagnostic tests to assess the patient's heart rhythm and function over time. This ongoing monitoring helps in detecting any changes early and allows timely intervention. Maintain open lines of communication with the patient, encouraging them to report any new symptoms or concerns between scheduled visits. This proactive approach helps in managing bradycardia effectively and preventing any complications. Work closely with other members of the healthcare team, including cardiologists, primary care providers, and pharmacists, to provide comprehensive care for the patient. This interdisciplinary approach ensures that all aspects of the patient's condition are addressed. Let's look at a typical patient presentation in cases of sinus bradycardia. Patients with sinus bradycardia may present with normal, low, or fluctuating blood pressure. It's important to monitor blood pressure regularly as significant drops can indicate decreased cardiac output and perfusion. A key characteristic of sinus bradycardia is its pulse rate of less than 60 beats per minute. It's essential to measure the pulse accurately, both manually and through ECG monitoring to confirm bradycardia. Typically, respiratory rate may remain within normal limits unless there is an underlying condition affecting respiration. However, monitor for signs of respiratory distress or changes in breathing patterns, as these could indicate worsening of the patient's condition or a coexisting problem. Many patients with sinus bradycardia report feeling unusually tired, or lethargic. This is due to the decreased heart rate, leading to reduced cardiac output and less oxygenated blood being delivered to the body's tissues. Dizziness or lightheadedness is common as a result of inadequate cerebral perfusion. This can be particularly noticeable when the patient changes position, such as standing up quickly. In more severe cases, patients may experience syncope or fainting. This occurs because the brain temporarily receives insufficient blood flow. Syncope in bradycardia is a critical symptom that requires immediate attention to prevent injury and address the underlying cause. Evaluate how sinus bradycardia impacts the patient's ability to perform daily activities. Ask about any recent changes in exercise tolerance or difficulties in completing routine tasks. Patients may report a decrease in their ability to engage in physical activities that they previously performed without difficulty. This can be due to the reduced cardiac output not meeting the body's increased demands during exertion. Assess how the bradycardia affects the patient's performance of activities of daily living, ADLs, such as bathing, dressing, or eating. Difficulty in performing these activities may indicate a need for further intervention or support. Make sure to take a detailed history of the patient's symptoms, including onset, duration, and any factors that exacerbate or relieve the symptoms. This helps in understanding the extent and the impact of the bradycardia. Conduct a thorough physical examination, including auscultation of the heart and lungs, checking peripheral pulses, and assessing capillary refill. Look for any signs of decreased perfusion or other abnormalities. Make sure to correlate the patient's reported symptoms with ECG findings and vital signs. This helps to determine the severity of the bradycardia and the appropriate management strategy. Now let's look at some conditions commonly associated with sinus bradycardia and understand the significance of each. Beta blocker use is a common cause of bradycardia. Beta blockers are a class of medications that reduce heart rate and contractility by blocking the effects of adrenaline on the beta receptors in the heart. They are commonly prescribed for conditions such as hypertension, angina, or other arrhythmias. By decreasing the heart's workload and oxygen demand, beta blockers can slow down the heart rate. In some cases, this reduction can be significant enough to cause sinus bradycardia. It's important to monitor patients on beta blockers for signs of bradycardia. If the heart rate becomes too slow, the medication dosage may need to be adjusted or alternative therapies considered. Hypothyroidism can also lead to a slow heart rate. Thyroid hormones play a key role in regulating metabolism, including heart rate. Hypothyroidism or low thyroid hormone levels can result in a slower metabolic rate and decreased heart rate. In addition to bradycardia, patients may present with fatigue, weight gain, cold intolerance, and depression. Recognizing these symptoms alongside bradycardia can aid in diagnosing hypothyroidism. Treating hypothyroidism with thyroid hormone replacement therapy often normalizes the heart rate. Regular monitoring of thyroid function tests is essential to ensure appropriate treatment levels. Increased vagal tone is often seen in athletes or during sleep. The vagus nerve exerts a calming effect on the heart, slowing the heart rate through the parasympathetic nervous system. Increased vagal tone is common during rest, especially in well-conditioned athletes and during sleep. Athletes often have higher vagal tone due to their enhanced cardiovascular conditioning. This can result in a naturally lower resting heart rate, sometimes dipping into the bradycardia range. While increased vagal tone is typically benign and indicates good cardiovascular health in athletes, it's important to differentiate this from pathological bradycardia. Routine assessment should consider the patient's overall health and activity level. As individuals age, there is a natural decline in the intrinsic heart rate due to changes in the cardiac conduction system, including decreased responsiveness of the SA node. Elderly patients may exhibit sinus bradycardia as part of the normal aging process. This is generally asymptomatic and doesn't require treatment unless accompanied by symptoms or other cardiac conditions. Understanding that aging can contribute to bradycardia helps in managing expectations and treatment approaches in older adults. Routine monitoring and assessment are still necessary to ensure that the bradycardia is not symptomatic or indicative of other cardiac issues. Let's do a quick summary of what we've learned in this presentation. We can now identify sinus bradycardia on the ECG. There's a regular rhythm, The rate is less than 60 beats per minute. Every key wave has a QRS complex to go with it. The PR interval is between 0.12 and 0.2 seconds, and the QRS duration is between 0.06 and 0.12 seconds. We looked at the fact that the rate is controlled by the sinoatrial node, and it is being affected to a slower than usual rate due to things like an increased vagal tone, certain medications, intrinsic heart disease, or the normal processes of aging. We looked at the importance of monitoring and managing sinus bradycardia, remembering that these patients may be completely asymptomatic, but we still need to monitor and look for any symptoms as just fatigue, dizziness, syncope, or hypotension. We might need to administer atropine to increase the heart rate. And in more severe cases, particularly if bradycardia is persistent and symptomatic, a pacemaker may be required. We're going to educate our patients on recognizing symptoms of bradycardia and understanding the importance of regular follow-up appointments. They'll be advised on lifestyle modifications and the need to adhere to any prescribed medications or treatment plans. And we'll look at identifying and treating any underlying causes, such as hypothyroidism, electrolyte imbalances, or medication side effects to prevent the recurrence of bradycardia. This holistic approach ensures comprehensive patient care and management. Thank you for paying attention today. Now go on, get out there and do some nursey things.